hello everybody and welcome to Ovarian Cancer Australia's Information and Support webinar. My name is Anne-Marie and I'm one of the coordinators for the support programs. Before we begin, I'd like to acknowledge the traditional owners of the land that we're standing on, and I pay my respects to their elders past and present and any amongst us today. I would also like to acknowledge the Brockhoff Foundation for providing us with the funding opportunity to deliver this project. Today's webinar is Communication and Cancer, talking to your treatment team and loved ones. You can ask questions of our presenters by typing into the chat box, which is located at the bottom left-hand side of your screen. Your questions will be answered at the end of each speaker's presentation. Please keep in mind that our presenters can address individual medical cases. If you have particular questions, you are welcome to call the Ovarian Cancer Australia Information and Referral line. Today, we are very excited to welcome our presenters, Katharine Hodgkinson and Denise Firth. Dr. Katharine Hodgkinson is a clinical psychologist with over 18 years' experience in client care, research and education. She has a long-standing interest in women's cancer care and works in the hospital-based gynecological oncology service for 8 years. Denise Firth was diagnosed with breast cancer in 1988 and ovarian cancer in 2004. She's had surgery, radiotherapy, and numerous chemotherapy treatments. Denise is passionate about women sharing their experiences, support and informing each other. She happily gives insight into what has assisted her along her journey. I'd now like to pass you over to Dr. Katharine Hodgkinson to begin. Thanks, Katharine.
Thank you very much, Anne-Marie, and thank you very much for the invitation to talk. So we all know optimal, so I'm just locating the first slide. We all know optimal healthcare delivery requires really good communication. So in this session, I'm hoping to cover how best to discuss our concerns and our questions with our healthcare team, have a think about ways of talking about cancer with your family and with your loved ones, and that includes the children in your life, as well as some ideas about talking with and sharing your experiences with your wider set of social networks and at work. I work as a clinical psychologist, and it's a surprising amount of time is actually, in my appointments, is often devoted to this topic. It's tricky. Communication doesn't come as naturally as we all hope, but it's really important to get it right, not just through treatment, but through recovery and at other points in our care. One of the things about communication, and one of the things that makes it tricky, is that we really can only provide guidelines. There's no prescription, unfortunately, that works for all situations. So we need to apply the information with flexibility, and we need to really think about planning, seeking advice and reflection on what's helpful, what's been helpful in the past, what others have tried, as well as thinking about what we can try differently next time. I've had the privilege of working with many women and families affected by ovarian cancer over the years, and so a lot of the information I'm sharing today is based on what I've heard them talk about that's been helpful or not so helpful, as well as thinking about what the research tells us about communication. So the first point, it's tricky. Effective communication is a two-way process. But it's the basis of all good relationships in our life. Being able to say what we think and what we feel and being heard and understood is absolutely vital. But it's complex and it can go wrong. Often when we're discussing things that are personal, things that are very emotional, things that are controversial, or when there's uncertainty, we've all, I'm sure, got many experiences of when it doesn't go quite as smoothly as we hope. But the good news is as patients and health professionals, we both have a role in what happens and thinking about how to actually help this process. And over the years, psychologists and other health professionals become much more involved in thinking about communication skills and trying to navigate this area. So a lot of the medical programs now involve a lot of training on communication skills, so that hopefully health practitioners are getting better at managing it. So let's have a think about the multiple communication channels that exist around you. So if you look at yourself in the middle as the patient, if you can see on your screen, there may be children, there may be a partner in your life, there may be your oncologist, GP, nurses. There's a whole load of different people in your social network, as well as different people in the medical care team. And some of these will talk to each other, some of them won't. So there's a lot of people involved. Many of them will be new to you, and you'll often meet at a time of crisis. But also, when we look at the communication between those different people, there's often many filters that work, and this is through words and through actions. So there might be differences in language, in culture. There might be differences in non-verbal communication, words that are chosen, people's attitudes or expectations, as well as filters as far as what information we want to hear or what information we're comfortable discussing. And obviously many filters can work at one time. And there's many barriers that can get in the way of this simple process of delivering and hearing a message working effectively. So let's have a think firstly about communicating well with your team. As we said at the beginning, it's essential for the delivery of best practice. There's a legal and ethical underpinning to that, because our medical team need to provide information that we understand, and this is often needed with when we're making complex decisions. And it often ensures safety, but even survival at points. So it's absolutely fundamental to good care. As patients, people see it as critical to good care, to being understood and cared for, and being treated like a person, not just a number. We want up-to-date information. We want the right information at the right time, so that we feel confident that we're getting the best care and we're getting the best outcomes. And so there's guides through different states as far as for the healthcare professional on how they should deliver care, but there is also guides as the patient on your rights and responsibilities. And I think it's important just to flag that we also have a responsibility to communicate openly with our team, to share information, to give them updates. So although I think sometimes we can feel that we're bothering the doctor or being a pest, we might be asking too many questions, we actually have a responsibility to communicate openly and well with our care team. But it's tricky, isn't it? There's many barriers. And just having a think about these, the most obvious one is that a diagnosis of cancer is a life crisis for most people. It can be a very emotionally challenging time, and it can be very challenging at different points across your care. So we're not always in a good place to be thinking about what skills we should be using or how to communicate. We may be in pain, we may feel quite overwhelmed, exhausted, have chemo fog on board. We might have waited for a long time for the appointment. We might not have had particularly positive experiences with medical care in the past. So we bring all of this to our expectations about our conversations with our medical team. The other thing we know is there's a lot of research saying even of what is communicated in a appointment, we often only remember or recall a small percentage of that. Often the information is very complex. Often information can change and sands can shift, and this can be really quite difficult to accommodate when you're on the spot and dealing with so much. Families and who are maybe in attendance at the appointment might also not agree on what information they want, what their priority is, or how open they are to discuss different topics. So that can make it hard. And just like any relationship, we might not always click with our particular medical practitioner. These are just an example of some of the things that patients will often report. Often, I don't want to be a burden or worry them. People are often aware they might have waited in a busy waiting room. There's lots of other people that aren't very well and they don't want to take a lot of the doctor's time. So people are often very considerate of that, but also very concerned about not wanting to be seen to be complaining, or they may even think, look, if the doctor thought it was important, they would have raised it themselves. So we obviously have a whole lot of chatter in our heads that gets in the way of, which is another barrier in how we communicate. So we know that it's tricky. Let's have a think about some tips about what might be helpful. Fundamental, planning your appointment, thinking about preparing for your appointment. So things such as the timing of the appointment, things such as taking a support person with you, even things that, such as, making sure you have food on board, you're hydrated. We know that we'll often have to wait to see someone. Trying to actually manage our stress levels during that waiting time, particularly if we're aware that this might be quite a significant conversation we're going to have. Preparing a list of questions, I'm sure many of you do, and is really helpful. Think about prioritising what the important questions are and trying to stay to the point as well in the consultation. There's various bodies have put out question prompt sheets to help guide you on what questions might be useful, and things such as decision aids can also be helpful in trying to guide your questions. Other suggestions is when you're actually in the appointment, writing down answers or asking for written information or copies of diagrams, trying to educate yourself before about the sort of jargon that might come up, the sort of procedures or words, so that you feel that you're going into the consultation with some information on board. So trying to think with your communication skills, how to be specific, using I statements, asking for clarification if you don't understand, and maybe feeding back what you've heard to clarify your understanding. If in the appointment, if you are overwhelmed at particular points or distressed, you're probably not going to take on much information. So even asking for a pause or some time out, thinking about how to manage your emotions, how to manage stress, and that can be helpful, having support people there as well to be able to have a second pair of ears. Sometimes communication doesn't go as planned, relationships don't go as planned, so thinking about talking with your GP about how to access other sources of information. Think broadly about your care team, who else you can ask. Also, thinking about second opinions or accessing other resources. And there's bodies out there such as healthcare complaints that can help patients navigate when communication doesn't go as planned. The end of treatment is often quite a tricky time for people, and often a time when anxiety rises. It's often a time when people are processing what's happened, but also what does this mean for my future health. So thinking about communication, particularly at that point, getting information, making a plan, what you can do to improve your future health and reduce the risk of recurrence, understanding what surveillance means to you rather than the other women that you may meet in the waiting room who may have had different recommendations. Knowing what symptoms to look out for is really important, and what can be done about them so that every ache and pain doesn't trigger the alarm bell for you. There's also things such as survivorship care plans which have been put out, which are really a record of your treatment and thinking about your forward care planning. And so there's various ones of these. There's ones available through the Peter Mac Survivorship Centre in Melbourne. There's other things online, and I know in the Ovarian Cancer Australia Resilience Kit, there's a section in the diary for actually recording your care. So moving on, thinking about communicating with our loved ones, again, the barriers. Often our loved ones and our relationships will be deeply affected by the cancer experience. We will often want to protect others. It's very, very tricky thinking about discussing upsetting news with other people that we love. And the information is often complex. And as we mentioned before, there's often uncertainty, so that they're quite difficult messages to get across. Everyone has different information needs and responses, and there's often myths as far as communication. We mentioned one of the ones before, which is, communication comes naturally. Often the one in relationships is, the people in my life should understand what I need or know how to respond to me. That it isn't always that smooth. And of course, there's practical barriers. There might be fatigue, there might be a lack of time. We may have had a relative move into the house to help care for small children. So there's just not a lot of opportunity for time to communicate well. So thinking through how we communicate with our loved ones, again, preparation, finding a time, setting the scene, maybe sending a warning shot, saying, look, there's some difficult things I'd really like to talk with you about, or I'd like to bring you up to date on what the doctors are saying about how my treatment's going, maybe talking about small things, asking questions, trying to understand their understanding and what they want to know is really important before we proceed to provide information. Listening actively, we hear a lot of people talk about that's with our body language as well as our ears, and then feeding back to them what you've heard, what the discussion has been, and working out where to go. Obviously, the fundamentals, showing respect, trying to work out how to manage our emotions, thinking about not just words as a means of communication, but touch or hugs or smiles, and keep working it. It's not always going to be successful the first time. So humour and just taking the trouble to rethink, maybe getting some advice from others, sharing with others through support groups, through peer connect programs can be really valuable. When we're thinking about another area of the final area of communication, those in our broader lives, a lot of people say this can cause a lot of distress. People's comments, many of them might be unsolicited or unasked for, but often can be quite distressing for people. So, and some of you might relate to some of the bubbles that just went up. So thinking about taking control with others, thinking about planning ahead, being assertive, thinking about if conversations are too confronting or personal questions, how to respond to them. And sometimes people come up with their own little phrases like, look, thank you ever so much for asking. That's really kind of you. However, I'm just trying to focus on, enjoying the dinner tonight, or, I'd love to make it another time so we can have coffee and chat about that. So feeling that you can put some barriers up to stay in control. For some people, if that there's someone else in their social network that's newly diagnosed and they feel is leaning on them heavily, taking some control, or with the horror stories. Someone once shared this for me, which as soon as everyone, other people would say, oh gosh, my aunt had that, and rah, 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 she'll just put her hand up gently and say, look, I just want to stop you there, only do stories with happy endings. So just a very gentle way of being assertive, using a little bit of humour so that you don't then end up avoiding social opportunities because you can't deal with 1,000 questions when in actual fact you just want to hear about each other's grandkids or catch up and just have some fun outside of the cancer world. So the last topic I'm going to cover is talking to children and young adults. And these may be your own children, they may be neighbours, or they may be a whole range of other children in your life. What we know is cancer is very much a family illness. It has a ripple effect on your family, but also in your social world. And the children around you are often pretty curious. They're often pretty smart and perceptive, and often seem much smarter than their years would indicate. But if we aren't able to communicate them in a way that's appropriate for their age, they're probably not going to understand what's going on. They're probably going to draw their own conclusions, and these may be quite different to what's actually happening. So the trick is trying to balance avoidance with confrontation with communicating, and the balance of honesty and trust. So it is a really tricky area. Often our instinct is to really try and protect people. So being aware of our own feelings and barriers, being sensitive to when children or young adults may want to talk, so watching out for cues, listening and accepting their feelings, and providing reassurance. There's many things we can reassure the children in our life, and one is that they will continue to be loved and cared for, and to talk about what isn't going to change. So being honest, gentle and hopeful. We've talked about appropriate language, trying to avoid euphemisms because they probably won't understand what the hell we're talking about. Being aware that this is really, and often talking about health, just like we talk about sex or drugs, it's an ongoing conversation that we have, and there's no one chance to do it perfectly. We'll also probably need to repeat information and introduce new information over time, and it's quite okay to say, look, that's a really good question. I'm not sure of the answer to that. I'm going to ask my nurse, or I don't know, but I'll find out and we'll talk again. So there's, as I said at the beginning, some very general suggestions for how you might talk to children, to loved ones, to other people in your life. There's a lot of resources out there that can help you. The cancer councils have great booklets talking to kids about cancer. They have great resources for school communities as well. We at Headway Health, we developed a resource on communicating effectively with your healthcare team, which is on our website. Ovarian Cancer Australia have got a number of resources. Sometimes people will find it helpful to talk to someone outside of the family, and there may be a social worker and there may be a pastoral care worker through your treatment centre, or you may wish to access a psychologist. Medicare provides support for access to private psychology services through GP mental health care plans. So your GP, as always, is a really important person to talk with and access about all aspects of your care, as well as the emotional aspects and as well as the, how to navigate this within your wider life. I've put up a list of websites that have got some helpful material on that you might want to look at. And again, always important to be really careful about the information that's out there and to go to reputable services. So I'm very happy. I'm really looking forward to hearing Denise's talk, and I'm very happy to, for myself or for both of us, to take questions or comments. So thank you, Anne-Marie.
Thanks very much, Katharine. That was really very interesting. Thank you very much. So I'd just like to welcome any questions from people who are participating in this webinar. I have received a couple of comments earlier via the registration process, and I've put that into the chat box. There's a comment from Brenda. She talks about empathy versus sympathy, and being on the receiving end of sympathy and pity when all you want to do is be seen as normal.
Yes, that's a really good comment, and I guess that really sort of fits in with some of those comments I put up in the little the sound bubbles before about how, you know, people often don't know what to say, and sometimes they'll, you know, it will come, although their heart might be in the right place, sometimes that will come across as quite unhelpful or disrespectful or demeaning. And a lot of people will talk very much about, wanting really to contain the impact of the cancer in their life. But someone recently said to me the expression, the cancer has to live with me just as well as I have to live with the cancer, but trying to actually not let it define you, and trying to maintain as much control in other areas of your life and to be as normal as possible is really important, and that's certainly something people talk a lot about.
Yeah. We've had a question, thanks for that, Katharine. We've had a question from Jeanette Trevor. She says, what does one say to one's oncologist when one is changing to another hospital in the same city?
And so I'm wondering, is that in the context of not being happy with care?
This is the question we received this question during the registration process.
Okay, yeah. Look, It's tricky, and I guess everyone would have a different view. I would certainly know some patients would just move their care and ask for their notes to be transferred without providing any feedback. Sometimes people, especially if it's been a longer standing relationship, or that they might wish to have a discussion, and yes, those discussions can be quite difficult. I guess I would see that the oncologists, as we said at the very beginning, some of them, have a different levels of skills in this area. Sometimes receiving some feedback or suggestions about what might be helpful, sometimes people feel that that's valuable and that might actually benefit future patients, even though that person may not feel a good match with that particular doctor. So it is a tricky area to navigate.
Yes. Thanks, Katharine. Annette B has just commented that she thinks it's better to ask a person, do you feel as good as you look today? Rather than always saying, you look well, which then negates your chance to talk.
Yeah, that's fantastic. And I've heard other patients that they say, the question is, do you feel as well as you look today? Because there's a lovely complimentary nature to, I can see you look well, but also you're acknowledging that it may have taken quite a bit of effort to get up, to get the lipstick on, and to be presenting in this way today. And yes, it doesn't shut down the conversation about what's really, really going on. It's very much an opener and a way of providing permission to say, well, actually, having a shocker today. And then you can see whether that other person is willing to continue the conversation and actually be a support person to you.
Thank you, Katharine. Do we have any further questions from participants before we move on to our next presenter? If you do have a question, as I said, please feel free to type your question into the chat box on the bottom left hand of your screen.